It was a rainy and eventful day as the Dr. Loretta team found its way to the beautiful home of the Iyase of the Benin Kingdom. Chief Dr. Sam Ubi, a chief par excellence and the Prime Minister of the Benin Kingdom. At his opulent home, the team members all took their turns to present their projects to the Prime Minister, and it was a showcase of cultural beauty. As the team members who spoke all displayed their varying mastery of the EDO language, including Dr. Loretta, who introduced herself, told her story and the inspiration behind her project and aspiration in fluid Benin language.
It is a Iyase now na kekunima the short notice na and either me tell me where, or either me keep pass or I tell me where most times, or where the few year do ta, no we need when year do the yawe me no tell me, you cannot tell no media yo, on our way having exam walk by retired justice Idaro, or where chief son there, and coincidentally I think two of you have been Iyase. So era we Richard Osagiwa Harold Ogbo So I was born in Benin City about I think 1977, Civil Service Section, Central Hospital. In the LORETTA, yes, 1977. Yeah, we wake up, so yes, school when they are high one, when married, yes, school when we have Federal Benin, then Uniben, then I don't know the area book. Niya Mare we go every time, and my area with me every time. Even one time when I hear or John Way cancel. Okay, well, train over in UK and in England.
It's late.
Yes, it's late, sir. My condolences. Yes, sir. My condolences. You know, Irene.
Yes.
I was in February Benin with Irene. She was my head girl. So again, when we picture yourself. Yes, sir. I want to know. A lot of water. So, and I've been coming back. You know, even with Donnie engaging in my mouth totally with all of my heart. We never need any yakoko. Any matter where's the pidgin into one as a bunoa correct, was the domain or mamma do. Now in my marriage, in my kidney, a hair, can you carry? Or which we are sell guy Richard, rider guy, Erabos Agede, go. We are sell wood, okay. Then I migrate and I wrote one number 2 in Lagos Street, come out that most last year, I look or we like. Then each guy we all beer Josephine, Josephine on beer, the first secular, Mama Josephine. The first grandchild of our foreign Israel. And a pirate was at the way migrated Calabar when we Mahia but by and large, I think then he gave me Nagai go there too, partly a go there. And he not be a Ubiaja. So very grounded in our roots. And we train up a child the way you want the child to grow, and the child will not depart from it. So I'm not depart from me at all. Yeah, I know that way. I can man I go, Nina Lily give me a key, and I'm secondly Sima, you know. But you know, realize it. And when we Monaco call in our friends, when they read my Pokemon, all of a sudden, it's a bit difficult to adjust. But then we need so in me, in a way, yeah, maintain time, in a day focus, in a understanding the principles of delayed gratification. In a way, understanding when we are raised in a way, there is something called physical poverty and the poverty of the soul. In a depend on that physical poverty, in a maintain levitate above it. When no damage in a gonna, yes, succeed at all. So through those times, you know, we stayed strong. And I read Italia, you know, and it helped. Eti George Maropa because there's one at Boma there. But when they ran a cookie money, or Gele was serve as foundation. So I'm going to and since, you know, Edo State people have been dear to my heart, especially the new kingdom. So now, in a way, this Loretta Healthcare Initiative, you know, we all baby worry, maybe we see a worry then he were o, you know, we've been here now. I don't want to those states so that in my man, they need to understand they need to be here. Have a happy a being here. Everybody our hair a government. So we are me. Ni me na alele ji me here kini mi wan di. Ebe so again I always suffer no, but o denu sa obo a oni la. Obege so do ka oni beg. Me atota iwe kini ere ni. Na ya we yo sabo ye no re kini do wa we wu. Ye wa we so yo so he o wa igbo te ye kini de bo si nu. Ye re ma. My way postmortem, my way so. The next day, a similar picture. The next week, I don't know to me. You know, mommy, where you no see any? Oh, me, mama, wait, baby, what going? Now, mommy, oh, you know, my hair kinanya. You know, why they blood pressure, why they sugar, a breast check in a only hope. Then me now who were one and waiting or where or not another. You know, a blood pressure never take on as example. A letter. You know, suddenly or my collapse. You know, secondly, we're here to carry a kimananya or my way after every 30 minutes. I make like I knew where when I knew where here. I mean, 1 minute. Now I made blood clots. No, I suddenly while with dislodge of a bomb. You know, I know ya babo, my mobile postmortem in Makere, Amunazi, Amunoso. You know, when Ote Magbe, Mana Metia, Moe, like a small clinic, ma mwere ki ma gwa biji mana gwa na we begenia iko ya ni fi yare mana iko ni hawa yare mana na we toilet go for we ki na wo mi ina we iko ni na wa na bpm ma we ha yare ona we mata no we o sa abo agwa mu so we nu we na oh you see all those were practice time so understand like a sort of root cause analysis sir, to understand that what will make the change in the lives of our people are the simple things first. And also their health-seeking behavior. Even so as you know, upon our time here again, we be one ton, or when I feel me queen, you know, I do a pastor. In our time here, we know more year, or 50 years. In our fear now, when mommy hot flushes, you know, we know where our own, you know, where matter. In our time of only different things and everything. And God relief. So, sir, to cut a long story short, I think the time has now come because, you know, online is a case to you start thinking more about what can I give rather than what can I get. So with the aid of volunteers, when I look at the ordinary community people, now with Loretta Health Initiative now, despite women order from where with charity day since for over 11 years, every year we give a brand new laptop and cash money in pounds to the best graduating surgical students. But now we want to make this community based, move from market to market.
Surgical student where?
In Unibensa, University of Benin, sir. For 11 years we have not missed it. He's the liaison in Edo State, sir. A very reliable liaison. And the students look forward to that every swearing in. They look forward to that brand new laptop. They all work hard now. And as an objective measure, we now saw that the pass rate in surgery has gone up. Because we are celebrating excellence in that little way. And it's our joy that we hope that many people are now taking after us. So this health initiative is a continuation of what we've been doing, sir. So in a way, Mado Tamao, Mado collective, ni ma do we te eno we so no ye we bi ke because e no one we hin enu abere bi total ma ha amu janya gbima na e bege e 2024 no we dey na ma a chiwa here he only role for the governorship of our state.
The Iyase, a philanthropist of no mean repute, also addressed the entourage, sharing his invaluable words of wisdom with them.
Yes. Yes, sir. Yes, sir. Yes. In your daddy. Yes, sir.
Everyone will take it.
Say, good words.
Wazee kwa ni wanari kine iwa pike lewa le haso yake so do wele ya kwa la nyane yane ma ya so ara me no ma sina ga attack
To take wings.
yes so wala nile ade waya fe me mate aka IGBE do ya pe ile ya wala ni na unye hu ni emi ya na dia you do I get very annoyed come on unye hu no be season that season ama we wo ari gba we ba ha e see anybody comes in. Yes, so but so yeah, the doing ya ni ni te au da ho okay que no ayu o di go ko ti ku e o la no bio ina ute mume ni ya we ni so ni setting we so one all when we are working. What do I try not give excuse? Papa, ego aki no ri. Never know ego. Omo e ma o aro ko go na ri fo. Na fo ni the secretary ba. But I know if you are quite o ni e mi o. No okay, but no challenge. You know, I know what to do. We're going to be a will. And I'll be a little I know that you're doing. Oh, honey, I said, but it's late now. So, and that's then he has a tea room. Oui, what you know. Madame, everywhere I know, I give her. Area Warway, everyone Arway. No, am I moving? You don't have to. But, I'm moving, but you know, Baba Area Warway.
Speaking on the project afterwards, the Iyase praised Dr. Loretta for spearheading a project that would serve to strengthen his own efforts, as he had kick-started a health NGO of his own about 10 years ago, an NGO that was focused on aiding people with diabetes, and stated that hers is more efficient.
He's just come to strengthen what I try to do. I sort of stopped
and left a lot of things with my young man, Lawrence. And she is coming to do the same thing, perhaps more efficiently, because she seems to want to go around the whole place. And I think it's a very, very good thing. We did this thing for about 10 years, and we enjoyed it. Because of that, this young man is known all over the state.
Yes.
So I think it's a very good thing. It is beneficial. A lot of people who don't have medical help get this help. So I think it's very good, and I encourage it.
Dr. Loretta, while appreciating the erudite chief for his invaluable wisdom and blessings, affirmed that it was only natural that she identified herself with a giant who had made great strides towards helping Edo people with good health.
Yes. He said. He said. He said. He said. He said. Say we stand on the shoulders of giants, and I was very, very pleased to know that our Iyase has for many years, 10 years, been catering for the healthcare of the community, for our people, diabetic checks, free medication is only laudable. So we of the Loretta Health Initiative, we stand on the shoulders of these giants to bring healthcare to the community. Like we say, Edo State Health in Edo State hands.
On his own part, Dr. Kennedy Aloha, an orthopedic surgeon and the former consultant in charge of the Iyase's Diabetic Clinic NGO, expressed happiness at being part of the Dr. Loretta Health Outreach team, as it was a way to help his community to be more aware of their health.
As a medical doctor, this Dr. Loretta's medical outreach is of utmost importance to me because of my commitment, dedication, in as a doctor, contributing my own part, quota, to improve the healthcare status of our people. So when Dr. Loretta Healthcare Initiative brought up this idea, I quickly, keyed into it. And I strongly believe, by the grace of God, that bringing healthcare closer to our people will go a long way in bringing about the much needed awareness about their health to them. Common, health, conditions that they may overlook, especially the market women, and also on the need for them to, from time to time, see it as a responsibility of theirs to come for regular checkups. So it is something I'm looking forward to, with great expectation. And I strongly believe that people will benefit from it. And don't forget that, during the process, we'll check their BP, check their blood sugar. We will counsel them. If there are other health challenges they have, we'll listen to them and we'll counsel them appropriately. And we'll give them free diabetic medications, those who are diabetic, free antihypertensive medication, those who are hypertensive. And of course, any other common illness they may have will also, grant them, audience. So that at the end of the day, it's going to be very, very robust, medical outreach. And I believe they will benefit very, very immensely from the outreach.
From the home of traditional royalty, the crew found its way next to the state headquarters of the Labour Party, where the good Dr. Loretta Oduare Ogboro Oko formally announced her intention to contest for the position of the Edo State Governor with the support of the Labour Party in the 2024 governorship elections of the state. The doctor was well received by the state's Labour Party leadership, who praised her boldness for taking up the challenge to run for governorship as a woman. the state exco, while stating that they cannot offer her their full support, as the primaries haven't yet decided who the party's flag bearer will be, advised her and her team on some guidelines as regards political contest in the state. They applauded her for coming to the state secretariat to formally identify herself with the party and expressed optimism that if she works hard enough on getting the people to support her, she will get to the top. Speaking on their own as regards the visit, Barrister Patrick Agbontain Ugeva, Edo South leader of the Labour Party and Deputy State Chairman, expressed happiness at having her on board the Labour Party. And Comrade Paul Adewumi Enomayo, the Oredo local government chairman of the Labour Party, described the doctor as someone God directed to take up the mantle of leadership in the state.
I have seen her as somebody that God has directed to take a mantle that all men have been failing since in this state and at the same time in this country. In time to come, he will rise from Edo State as a governor and become a president. That is what I wish for her, because she has all it takes as a leader.
Also speaking on Dr. Loretta and her vision, Mrs. Pauline Omogbele, the Labour Party state women leader, who was also a former deputy governorship candidate for the party in the last Edo State governorship election, stated that it was important that Dr. Loretta gave due honor to the party so that they can in turn guide her and also give her support.
If you want to run for a political office on a particular platform, you have to first give honor to whom honor is due. You have to come and see the state. If you're running around like some of them are running all over the place, the party doesn't know you. So if anything happens outside or certain statements are made, we will deny you because we don't know you. So when you come in, we give you a guide. You need to watch what you say. There are guidelines to elections. There are timetables. So we'll be able to give you a guide as to when to say vote for me, when to put up certain things. So it's good you come and interact with the state because you get a proper direction and guide as to how to do your things.
The women leader, while alluding to girl power, stated that she was happy with Dr. Loretta stepping forward, as it would serve as an example for young girls and women.
I just met her. Like I said to her, I've seen her billboards around, and I've been excited because she's a woman. I'm a woman. So the young girls will say girl power. It's time for girl power. It's time for us to embrace leadership by females in Nigeria and specifically in Edo State. We've witnessed power by leadership by men. Let's the women try. In the last election, 2020, I was a deputy governorship candidate for Labour Party. And so seeing a female coming out to aspire for the #1 seat, I'm excited. I want to interact with her more. I want to know what she has for especially the women and the children. I want to know what she has for the state. What ideas she has, what changes she thinks she can bring to the table to change the narratives based on our current situation in the state. So yes, I want to see what she has to bring to the table.